because of the dearth of information. For example, I always like to give this example. If you go to a village that has not had any form of development and they've never seen an aeroplane before, or they've never seen a bicycle, you can't give them the concept of the aeroplane and expect them to understand it. Okay, this person has never seen a bicycle that has two wheels, and then you're trying to tell him that something that is metal can fly. Once he sees an aeroplane in the sky, he's going to think it's something very scary and he's going to run. So that's the way we saw mental health. Everybody felt that talking about mental health issues or mental health problems on its own was something worthy of stigma because they did not understand it. They did not know, oh, okay, there are chemicals in my brain that sometimes there might be an imbalance and can cause me to behave different and can change my mood, can change my behavior, can change everything about me. And so we wanted to get that information about out there, and social media was like the fastest and easiest tool. The major challenge I would say was the fact that not everybody's on social media. So we could only reach those who were using, which were mostly the young people. And we still needed to go into the streets. We still needed to do more physical outreaches to get people talking. It's been better, unlike when we started a couple of years ago, when you post about mental health and people be like, oh, no, what are you talking about? You're talking about crazy people, you're talking about mad people. But now everybody has started to come to the awareness that we all have mental health and we all need to take care of it the same way we take care of our physical health. So we're definitely not there yet because we still need to do a lot of work, but at least there's an improvement between when we started and where we are now.
Okay, so other than awareness, I mean, we're in agreement that awareness is a key issue in terms of mental health as a subject in Nigeria. But aside from awareness, what other key issues have you encountered in your experience?
Who's taking that?
I was speaking to Dr. Wande, sorry, as a follow-up to what you said.
Okay, so apart from awareness, another problem was access. So a lot of people are aware that they have mental health or that they have mental health problems, but seeking for help has been an issue. A lot of people don't know that they can just walk into any hospital to speak with a professional and then probably get a referral to government hospitals, or just even walk into like a psychiatric hospital. They believe it still boils again down to stigma. They believe once you walk into a psychiatric hospital, everybody's going to see you walk in there and they're going to say, oh, this person has serious issues, this person is mad. So that access, that health-seeking behavior, we're not there yet. A lot of people still don't want to go to the hospitals, and which was why a lot of us had to start helplines. We had to open lines, create phone lines that people could call, okay, talk to a professional, and then for a couple of sessions, we didn't used to do more than 3, so that we still had to refer them to see psychiatrists or psychologists, which most people do not want to do. I don't know. I still think it's because of the stigma. And even though it's improving, at least more people are willing. More people would say, okay, thank you. I'm glad I was able to talk to you, but okay, I understand now that I need to go to the hospital. So it's still the stigma thing. And even though it's getting better, I still think we have a lot of work to do as regards getting people to actually seek that help.
Thank you. Dr. Kafaya, do you have any other issues that you've encountered aside from, like Dr. Wande said, the issue of stigma, health seeking behavior, access, as well as awareness? Which other issues can you add to what
there's the issue of personnel. So I mean, there's the issue of personnel, definitely. There is gross, there's gross shortage in terms of the people who can actually provide this help that we're talking about. We are all aware of the ongoing brain drain, and I know, so I mean, whenever I actually talk about this one, it's something that I actually even get emotional about it. You know, even many of my colleagues that I finished residency with, every other week they're leaving the country. And for me, it's a personal struggle that I have, because in my mind, I'm like, so what am I doing here? You know, so I mean, I always tell myself I don't have that personal conviction yet to leave. But the truth is, I see my colleagues leave all the time, and then I keep questioning myself, you know, so it's like, it's a big problem. So yes, we have, you know, the deficit in personnel. We have obviously the mental health as well as, you know, health in general is grossly underfunded. So there's a lot of problems there. We don't have enough services. If you have, I mean, you should have at least, you know, setups where people can walk in, like the primary healthcare centers, and you should be able to access a clinical psychologist, you should be able to access you know, a social worker, and then if they now, and a psychiatric nurse, and then if they even now need, you know, expertise care, then they can have a clinical a psychiatrist walk in. So imagine if you have in every local government where there is a primary healthcare center, you can have access. That's what we're talking about. So we don't have enough services at all to deal with these problems that we're talking about. So funding, personnel, and then the issue of, you know, the beliefs. Our belief is another thing that I think is really holding us back. There is so much over spiritualization of these issues. You know, when you're talking about, you know, somebody, you know, hearing voices, you know, the default thing is this person has been possessed, you know, and every day I see people of, you know, very staunch in faith, either Muslims or Christian, who have believed that they are possessed. And we know that these things are also in the diagnostic guidelines, that this is an illness. It's a psychotic state of an individual, and what they require is medications. But these people would have already been subjected to harrows. They would have been asked to do, you know, untold things, inhumane things in the form of treatment. So there is still a lot, you know, that needs to be handled. And I think that with medical religious collaborations, if we can get, you know, our religious leaders to buy into this knowledge that we're trying to put out there, there would be, you know, a lot of people would also come to the help that they need.
Thank you very much. I think to summarize both your statements, then it means that there needs to be a total systemic overhaul in terms of education, in terms of funding. And I would say again, Dr. Kafaya, thank you for not running away. I know that, for every doctor who's around, every day you wake up, you ask yourself, what am I still doing here? Because many of your colleagues, many of your friends have left, and they seem to be doing far better than you are doing financially. So it's it's a strong conviction, and would like to appreciate both of you for staying to fight the fight. So back to the topic now. For most of us, when we have the first contact most of us have when there's any mental health issue, is usually with a friend. Now, one of the things you said earlier was that level of awareness is low, even though it's getting better. Education is a problem. People do not know much about mental health. So people just wing it based on what they understand and what they think is right. So now, what kind of advice would you give to people out there who may be the first contact with a friend or a family member who has a mental health condition, maybe like depression or anxiety? What are the things to look out for? How do you encourage them? What are the kind of things you say to them? I know that there have been so many people online who've been trying. I know Mentally Health Aware, I think that's their name, has been doing a lot of campaigns, especially when it comes to depression and suicide. And they tell people that, look, you don't tell somebody who's suicidal that, oh, it's a selfish thing. Oh, what about, you know, there are certain trigger words you don't say to people So, in your experience, Dr. Kafaya, what can I say if I'm a layman and I meet somebody who seems to be depressed or has an anxiety disorder? What do I say? What shouldn't I say so I don't end up worsening the situation?
When I'm talking, so usually I like to give, it's more like what are the things that I need to also be aware? How can I be empowered to help another person? And the first thing I always say is we're in the period where we need a general rebirth and awakening in different areas of our lives. And knowledge is very key and very empowering. The average youth in Nigeria were very versatile, and when it comes to using the internet, to get information. But I think that this is one aspect where I can't give you all the things that you would do, talking about anxiety, talking about depression, suicide, people hallucinating, or somebody that is using medications. But there are resources that we can use. The first thing is when somebody approaches you, the first thing is you want to be ready to just listen, just let them even say, and I know this is difficult because I have to do a lot of listening all the time, and I know that it's not easy to actually sit down, but you have to be ready to, if you want to help, then you have to be ready to listen. Okay, and sometimes the silence just allows them to be able to continue to, to purge and say what is on their mind. It's like a balloon that needs to deflate, to just release some pressure. And when they talk, somehow they get a bit of relief, and by crying or other accompanying reactions, that's catharsis. It's healing. It's the first step to healing. So be calm enough to listen to them and be just empathetic. And then there's some words like, I'm here for you, I support you, I might not understand what you're going through, but but I'm here to help in any way. The next thing would be that I had mentioned that before. You have to empower yourself. You must know the right things, that this person is going through. Somebody can't come to you and say, oh, I have been feeling this way or out of sorts, and the first thing you're saying is, oh, you might need to pray more, or is it something? Do you understand? I mean, emotional struggles, they have done a lot of prayers. Their family members have tried a lot of intervention. They have used all sorts of concussions and herbs. You'll be shocked where religious people would have gone to in the name of getting help for their people. So when you're telling them to go back to those things that have been tried, they have tried and it didn't work for them, it's like you don't really get it. You're sending them back to and some of those things are very traumatizing for them. Some of them are not allowed to sleep. Some of them are not allowed to take certain food. Some of them have gone through a lot of, very dehumanizing, rituals, all in the name of getting treatment. The next thing is that you might need to, through research and asking the appropriate question, you might need to find them the kind of help that is suited for them. So use internet or ask questions from the right people. This person is going through this, and what can I do to help this person? And you might need to go another step further to connect them to the help. I know a lot of people who would call and say, oh, my friend is going through this. I need to connect them to you. So be ready to go a step further to connect them to the help. The one that you can even now do that they might turn down, but it's nice to to offer is, I'm even willing to accompany you. It's like you're helping them to remove that sense of stigma, because many of them, Dr. Wande said, many people don't want to come to, facilities that are associated with mental health or psychiatric facilities because of the stigma. A lot of people are afraid of entering the Federal Neuropsychiatric Hospital in Yaba. Sometimes you can even say, okay, go to the Department of Psychiatry in Luth, because it's a teaching hospital. Nobody knows what department you're going to, just go there. So there's still a lot of stigma, but if you accompany them, you're also helping them to remove that part of stigma and say, I'm with you, I will go with you. Let us share this stigma together. And like she has also said, this help-seeking behavior of everybody needs to change. See, we're humans first, and there are different domains to our health. Mental health is one of them. We also need to work on that aspect of ourselves that tends to shame and to attach guilt to our experiences. You're not going through these things because of by anything that you have gone through, that you have done. It's a time that you need to get help, and you should, by all means, try and quieten those voices that are likely to push stigma and self blame and all of that forward, and instead, hold on to the one that will allow you to access help. And then finally, if you know anyone who's going through any struggles, you want to provide other forms of support. Listen to them, let them know that they are there for them. Watch out for the signals that might show that their illness is taking a different turn. Somebody starts saying that if I leave this world, I wonder if I'm going to be missed. They might be contemplating suicide. Or this is, I can't take it anymore. I feel really overwhelmed. I'm tired. I just feel like I want to disappear. That might be a passive suicidal thoughts being expressed that way. So look out for those and those things can only be done if you're empowered. Every individual, we need to all be empowered, because I don't know if there's any household who does not have their own person that is struggling. I've done my own assessment of my own household, and I know, and from time to time I check my own people, because I know that there is no immunity to this thing. We are all vulnerable, and from time to time, certain situations in our lives can expose us to this, to this side of it.
Yeah. Thank you. So in summary, you're saying that the key thing is that we all need to, first of all, educate ourselves so we can know what to look out for. We need to be empathetic. We need to show that we are supportive, and then we need to be able to express reassurance to these people. Even if we have to go as far as saying, look, I will go with you. The idea is to make them not feel like they are alone in this. So that is very, very insightful, and thank you. Dr. Wande, when we were talking earlier about factors and everything, we talked about awareness, we talked about education, stigma, and all that. Is cost also a barrier? How expensive is it to access mental health services? So if I wanted to have a session now, for example, how deep do I have to go into my pocket? We know that most times one session may not be adequate. People will require multiple sessions. So do I have to break the bank for this? Yeah, so Dr. Wande, is cost a barrier?
Okay, so for a lot of people, actually, cost is a barrier, more like implied cost, what you're thinking it will be. So we are of the notion in Nigeria that healthcare is expensive, generally, because we almost always have to pay out of pocket. And it's not a lie. Healthcare, good healthcare is not cheap. Good healthcare is not cheap. And so mental health care too is also thought to not be cheap. Government hospitals have helped in a very good way, because the cost of accessing care there, even while it might be expensive for some people, but for most people, it's still somewhat cheap. Okay, so saying cheap, cheap is relative, cost is relative.
Yes.
What I think, or what I would consider to be cheap for me, will not be cheap for someone else. So it's hard to say, but I think the cost for mental health care in government hospitals versus private facilities is relatively cheap. Okay. You can have sessions with psychologists. I know for Federal Neuropsychiatry Yaba, initially I know that your first session used to be 1,000, and then subsequent sessions of 500 or 750. So that is relatively cheap. It's like the cost of one meal. For private psychiatrists, private psychologists, it might not be that cheap. Like, I know of some people who charge 5,000 naira per session. There's 10, there's 15, up to 50, depending on how many sessions. What some of them have tried to do nowadays is create packages. So maybe you get, you pay a deposit and then you get a couple of sessions. Maybe you pay a deposit, you get 5 sessions. And then after those sessions, you reevaluate and see, okay, would you need further sessions? Or would we now say maybe once a week, once a month, and then that. So cost is a very, 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 very big issue when it comes to accessing care. But at least I know that getting that same care in the government hospital is relatively cheap. Problem is not enough personnel to give that care in the government hospitals. So your wait time, there's going to be a lot of waiting. So a lot of people know that, okay, going to the government hospitals, there's going to be a longer waiting time because we don't have enough. We don't have enough personnel. So they would rather go to private, which is not also cheap. So yeah. Cost is a really big issue. Cost is a really big issue.
Yeah, I agree with you, especially considering the fact that I can't remember the exact percentage now, but majority of Nigerians are living under, have to survive under $2, with under $2 a day.
Yes.
So even at that, even at 500 naira per session or 1,000 naira per session, it's still a lot more than what most people can afford. So how then do you think we can address this issue of access, either from cost or from whatever the issue is? Because I think what we are looking at now is how do we then achieve universal access? I mean, it's one thing for people to be educated enough to know that they require care. It's now another for there to be access. So I mean, realize that, oh, I need to see a psychologist, but then, hey, I don't have money, or if I have money, I don't know where there's any psychologist, or I don't even know where psychologists. You know, it's a multi-layered issue. How then do we address this? In what ways?
Okay, so the major thing, or the most important thing, will be government will to do something about it. If the government doesn't still see universal mental health coverage as a big issue, then not so much. Like currently, so many NGOs are springing up. So many people are trying to volunteer personally to make sure people get this mental health coverage. People are opening toll-free lines. People are counselors, psychologists, psychiatrists are volunteering their time and money and everything. But if the government doesn't make them available, if the government doesn't encourage people to become mental health professionals on the one hand and pay them for their services, okay, does not bring mental health care to the grassroots, like Dr. Kafaya mentioned, primary healthcare centers. There are primary healthcare centers in every local government. There should be at least a counselor or a clinical psychologist at these places so that people can know, because primary healthcare, everything you go to do there is usually free. Once in a while, maybe they make you pay for some drugs that are not available, or everything in primary healthcare centers is supposed to be free. So if people know that, oh, I'm having a challenge, I can just walk into this primary healthcare center and I'm going to get care for free, I'm going to see a psychologist for free, people would go. You understand? So the government has a lot to do for us. They have a lot. There's not, NGOs can't do everything. Personal individuals can't do everything. They can't create this access. We can only do the little we can. But if they could provide those services at the grassroots level for free, even if it's not for free, even if it's for a token cost, but increase the access, that would actually increase people's access to the care and also help with cost.
Okay, thank you. Dr. Kafaya, what do you think can be done, in addition to what Dr. Wande has said, what do you think can be done to improve access, the issue of access generally?
Okay, so I mean, obviously she said a lot, because the truth is we still know that government goodwill is what is going to do a lot. Then obviously when we also have, it's incorporated into the National Healthcare Insurance Scheme, that's another way. Because now we know that many Nigerians also have access to better healthcare, because now, where they work or the government parastatals they work have allowed them to key into the good private, there's some private hospitals in Nigeria that if you say, if for instance somebody calls me and says, my person has typhoid and is admitted, I'll be like, is this the HMO that is covered? Because I believe that the hospitals under the HMO scheme at least would be verified and they have a lot of government regulations. So if you can also get that kind of commitment towards mental health, so that people get prompt access and to quality, we know that the people they're going to meet in that place, they know what they're doing. It's not just people who have just sprung up, because mental health is where people fetch a lot of money from it. They get a lot of money. Yes. You have someone who has a lot of money and lands in the wrong hands, they will milk you dry. Okay, I have people who would say that, if you know how much I've spent since I had this diagnosis of anxiety, they will have spent millions. And I'll tell them, if I've been seeing you in the last 10 years, I doubt that I've collected all that money from you. It's the reality. A lot of people get milked because of the wrong, getting help in the wrong places. Yeah. So if you can get what she has said, government goodwill, funding in the right place, more personnel in the teaching hospital. So halting this brain drain, because I don't see how they don't want to go and bring these people back again. Halting this brain drain before it gets out of hand. Okay, we have statistics of the psychiatrists in Nigeria, maybe less than 200 psychiatrists, to cater for all the all the population that we have, 200 million Nigerians. But we don't have the statistics for the clinical psychologists. And I tell you that they are also very important. Before an individual should even be talking of seeing a clinical a psychiatrist, you should have, possibly seen a psychiatrist first, gotten your diagnosis, and then gotten the standard plan of what needs to be done for you. We also need the psychiatric nurses. We also need, the social workers. We also need counselors. There's so many other cadres of, allied mental health professionals that need to be empowered. So it's a lot. So the NHIS definitely, goodwill, subsidization of these medications, and and many other things that she has mentioned.
So government policy, health insurance, increase in facilities and personnel resources are things that need to all come together to increase access.
Yes, it will definitely reduce people having to pay out of their pockets.
Okay. Yes. Dr. Kafaya. So Dr. Kafaya, again, we've talked about people being the first, friends and family being the first point of contact when people develop mental health conditions. At what stage would you recommend that people seek help concerning their mental state? So take Mr. A, for example, who's feeling some type of way because of all the bad news going on, the protests, COVID, job loss of income. Now, at what point should Mr. A consider seeking help before it degenerates into maybe a suicidal situation or something?
So for every person, for everyone, usually for emotional illnesses, many times we are able to identify what a trigger is, and for majority of people, stressful situations are, so when I say stressful situations, stressful situations for some people can even be a positive life event. It can be a marriage, it can be a relocation, it can be having a baby. So anything that requires an individual to have to make certain changes, you need to make some adaptations to yourself or to your living situations, or what it can be a stressful condition for you, all right, or even the workplace, all right. So once when people are exposed to situations like this, stressful in nature, or that you can identify to be a possible trigger, anyone like that will actually have contact with some form of debriefing or some, access to just talking about what is going on. And as you would see, during this EndSARS protest, a lot of people came up with those kind of accesses, allowing people to come and talk about their struggles or their worries or their concerns or the changes in their behaviors or their emotions or lack of sleep or sleeping too much or the change in their sleep or in their eating pattern. So once there's been an identifiable trigger, people like that should have some form of access, to an expert. However, even if you see that all of that is happening, that this person seems to be coping, once for us to be able to confer a diagnosis, so somebody comes to me, for me to be able to confer a diagnosis, there would have been an established, that there are some symptoms, a change in either the behavior or the emotions of this person. Something would have been out of sorts. Oh, something is unusual in this person. This is not their usual pattern. You know, maybe they are more weepy now, or they're isolating themselves, or the way they talk, I just don't understand it. You know, I'm saying something and they're saying something else. So there is a deviation from normal. Is persisting. So it's not just, I mean, for all of us who have our struggles from time to time, I can maybe for 3 days I might not be able to sleep well, but then I return to my normal sleep pattern. So we would have regular interruptions in the things that are normal. But once there is a persistence, this change is becoming enduring. Okay, so that's why there is a timeline for us to make diagnosis for different conditions. For anxiety, it's more prolonged, maybe like 3 months of that, of this fearful nature accompanied by some physical symptoms. For depression, a change in the mood and other lifestyle for about 2 weeks. You know, hearing voices for a period, we'll be able to say, okay, this is a diagnosis. So it has to be enduring for a period. Okay, and then it's becoming distressful. It's causing distress to the person in it. You know, either in the sense that you see this person always crying, this person is beginning to talk about losing hope, and then even distress to the people around them. Of course, the mother cannot see that her child is going down. It will cause her some distress. All right. A woman cannot see her husband beginning to struggle, maybe from loss of the business and all of that, and then there's a lot of distress accompanying it. So there's distress to the person who is suffering it, and then distress to the people around them. And then the last one would be loss of functionality. So because of all these things that this person is going through, the symptoms that we have that is there, the enduring nature of these symptoms, the distress that is beginning to cause to this person and the people around them, now there is loss of functionality. So this person is no longer functioning as either somebody's child or somebody's husband or wife or somebody's employee or somebody's employer. Then they need to seek help. So it's not, I mean, I know that, yes, now there is a lot of, there's a very high index of suspicion. Somebody changes and you're like, oh, this person needs to, sometimes a watchful waiting is good. Observe what is happening, but if it has crossed this, you know, these marks that I've talked about for different conditions, then definitely they need to go and get help. But one thing is, for some people, for some illnesses, suicide will be contemplated, so it takes a while. But for some people, a sudden change in a sudden exposure to a traumatic situation or a sudden change in their life situations can cause something that is known as an impulsive suicidal behavior. So they don't even wait. So someone who has been exposed to something that is of very great magnitude, you want to watch out for them and ensure that you're looking out for the markers. You know, once they start to express or say anything that looks like, I think I'm done with this life. It's better for me to just, you know, find a permanent solution to my problem. You want to ask further questions to be sure that they are not contemplating suicide and they have a plan to hurt themselves.
Okay, so that is quite a lot to I mean, so essentially the first thing to look for is identify that there's been some sort of trigger event in the person's life. So like you said, it doesn't necessarily have to be a negative trigger. Somebody could get married and then suddenly, I mean, everybody feels marriage is a joyful thing, but all of a sudden, maybe the added financial burden of being married or living in close proximity with somebody, it acts as a trigger. So we need to look at triggers in the person's life. We also need to see that there's a sustained change in behavior or functionality. And then, I mean, so what then is, it will be difficult for people to relate with is the situations where you talk about impulsive suicide, where, you know, you're waiting to see, okay, this thing has happened. I want to be sure that this person is handling it well, is coping, but that person is not even waiting to go through the whole spectrum of behavioral change, and they just jump from one end to the other almost immediately. But I think the key thing, the key takeaway from everything you said is we need to be aware, self-aware, be aware of the people around us, family, friends, you know what is their normal. And then once you notice a deviation from their normal, then you can then, I know that quite a number of people who naturally are introverts. So that is their normal. And I know, at least from my medical training, that some mental conditions can make people become extroverted, like, talk excessively, overtly happier than usual, So it's to know the normal, and
Yes.
watch out for anything that deviates from the normal. Thank you very much, Dr. Kafaya. You just gave us a power-packed lecture on Dr. Wande. I would ask you this question mainly because you focus more on social media, mass media, right? And this question is around the protests. I mean, we all know that the whole protest snowballed from an online expression of outrage and became people massing in specific areas. So the protest and the impact on mental health. I mean, we all watched the DJ, what's her name now? DJ Switch, her live Instagram broadcast. I know I didn't go to sleep until about 3 a.m. that night because, I mean, it was traumatic, even though most of the images were dark, but you could imagine what was going on and what the guys who were actually on site were going through, the kind of emotions they were going through. So are we, by way of this last couple of weeks, are we looking at an upsurge in a generation of people who PTSD is a very, very strong possibility in this situation? By PTSD, I mean post-traumatic stress disorder, for those who are watching. It's a very strong likelihood for people. What plans do you have using your platform and the media that you use to sort of try and stem the possible effects, in fact, not the possible effects, the likely effects of Tuesday night, and even days before Tuesday when the thugs had already started coming out and attacking protesters? So, Dr. Wande, can we hear from you?
Okay, sorry, it's been breaking up a little bit here, so I didn't get all of the question. What I understand was that you asked about our plans concerning all the trauma that has befallen the country in the past couple of days. Yes?
Yeah, so I thought we know that, I mean, based on what has happened in the last few days, a lot of people will be suffering from some sort of trauma or the other, whether they were present at the protest site or they were watching the live broadcast. The whole of social media has been flooded with pictures and videos. If I had to disable automatic downloads from my phone because the videos just kept flooding in, So you have employed social media as your own tool, your main tool to create mental health awareness. Do you have any plans using your platform now to sort of step in as a preventive measure? Because, like I said earlier, post-traumatic stress disorder is a very strong possibility for many people following the recent events. So do you have any plans? How do you intend to help, so to speak, in this regard, using your platform?
Okay, so for us, I'm mentally aware. When the protest started, we started to curate resources that could help people, things you can read, what to do, coping mechanisms. And we curated a couple of resources which we have made available on all our platforms for people to read as regards sleep, eating habits, how to cope with the current trauma. It's a struggle, really, what the whole of Nigeria is facing right now. And we in a way, we anticipated that this was going to happen. So for us, we opened more phone lines because we already had just some hotlines that people could call to speak with professionals and all. But we had to open like 10 more which is not even still enough because we're getting a battery of calls and we still need to do more. So we're opening more. We're going to be opening more phone lines. We're getting more people to volunteer. We're trying to get more counselors, more psychologists, more psychiatrists, more people. We're getting more people trained also because it's not just everyone that can provide this kind of mental health first aid that people need right now. So we're getting more people trained. We're getting more volunteers to help with the phone lines to be able to like talk to people. We're also engaging more on our social media channels across Twitter, Instagram, Facebook, and WhatsApp also. Okay, so we're opening as many platforms for communication because most people need to do actually is talk about their issues, because talking is like the first step, and just have someone listen, even if you can't give advice, just have someone listen to them, because like Dr. Kafaya said, that's the first step, the catharsis, being able to talk about it, being able to have like a sounding board for your thoughts. So that's what we have provided, and that's what we're going to keep providing throughout this period.
Okay, thank you.
Can I just say that even before the phase of the PTSD, what many of us, and I say us because we are all in this and we are all vulnerable to this state, is we first of all pass through the acute stress reaction phase, and that's what a lot of us are going through. There's a lot of numbness, a lot of people feel like they are dazed, a lot of people are having like out-of-body experience, there's disruption in sleep, eating pattern, there's an increasing fear. Some people just have this, and then there's a feeling of being paralyzed. Like you're not sure, like you're in limbo. You're not sure exactly what is happening. It feels like things are detached. It's like a state of dissociation.
Paranoia.
Yes, so there's a lot, and that's, we need to all normalize that yes, in view of all that we have been exposed to, you use the word imagination, and that's the truth. Many people might not have been at the Lekki toll gate, but we all saw it. So we saw it, we digested it, we internalized it, we stored it up in our imagination somewhere, and it's going to act up. So that's what many people will go through, and we need to normalize that those experiences are okay, but if it gets out of hand, if it endures and it's becoming worse, after a month or so, then we can, you can move on to disorder. But right now, it's more of a reaction in all of us.
Yes.
Right. So then, Dr. Kafaya, I would then ask you, so based on all this, for those of us who are experiencing this signs, these symptoms, what tips can you give for us to be able to manage this and go past this? Because like you said, it's an acute phase, but then that acute phase is a lot for a lot of people to handle, for most people to handle. And in my medical training, I've seen trauma victims, but I still couldn't handle what I saw on Tuesday night, maybe because the circumstances were different, and that's the experience for a lot more people who don't even have medical backgrounds, who have probably never ever witnessed anything, that amount of blood or gore. So what tips can we use to help normalize, return that sense of normalcy back to our lives?
The first thing I'm going to say to anyone is we need to go back into like protect your own space, okay? Build, like a healthy environment for yourself. And if it means disconnecting from, because it depends on what you can take. We're all different. I, for one, I've always had that. I know how to do that. I always say, I call it, I don't look for trouble, in the sense that I don't look at things that is going to cause any form of emotion, negative emotions in me. So this is the time for a lot of people to withdraw from social media. There's so much going on. There's a lot of frightening news that some people, despite having not verified, they keep sharing things that are evoking a lot of fear in us. So take a step back, take a break if you need to, and then practice the survival. The thing right now is survival. We need to survive. We need to move, be alive tomorrow. So it's like, what's the goal? The goal is to survive. The goal is to be here tomorrow. That's where we are all at this point. And what can ensure that? Basic self-care. Like the tiniest of things that we overlook. Like remembering to eat. I'm telling you, some people will wake up in the morning on their beds, they're on phone. they've not had breakfast, they've not taken a shower, they've not used any medications. For people who have physical conditions or mental health conditions, they've not done any of that. From the beginning, they're on the phone, just, looking at those things, flipping, and before you know it, time has passed, and then your mental health takes another hit again. Withdraw from anything that is going to worsen where you're at in terms of your mental or your physical state, and then just go back to basic self-care. Please wake up in the morning. If you wish to, before the whole thing, or if you want to start saying a prayer, say a prayer. Move on to affirming yourself that it is bad, and a lot of people are going through this, but I'm going to be strong enough to be here tomorrow. Affirm yourself, encourage yourself, reassure yourself. Go on to take a shower, eat, use your medications if you need to. And then, it's tough right now, and everyone is struggling. Like I was telling somebody this morning, define what hope means to you. What is your own hope? For somebody, the hope is, just to make enough money to get out of this country. If that is what is your own hope, please hold on to it and let that be what is going to keep you here till tomorrow. Because I can tell you that people right now, they don't know what to do. People who have lost their businesses, people who have lost a loved one, it just feels like, nobody understands what they are going through. But I want them to know that we understand. I might not be able to really put the words, to connect to you, but please find what hope means to you and hold on to that hope. And then we need to all build our collective resilience, and it's just telling ourselves that, see, what has happened, I will come back from this. I will bounce back. It's the only thing that we can hold on to. That conviction that I will come through, I will come back from this. Death is the finality of every individual. And until death comes at the appointed time, just keep hoping and believing that things would, make a good turnaround for everyone.
Thank you. I can resonate with everything you said. Like I said, I first of all disconnected stopped my WhatsApp from automatically downloading images or videos because it was just too much. Prayer, yes, we can tap into that. Define your own hope. So, like you said, if your hope is to make enough money to just, like the youth say, japa, at least, I totally understand that, because it gives you something to focus on.
Yes.
Something to focus on, gives you something to hold on to, and that is really, really, really what we have at the end of the day, hope. We can't afford to lose hope, or else then all is lost. Dr. Wande, do you want to add any other tips? Maybe things you're doing online to especially, I'm talking to two different two people who use two different modes of engagement on the same topic. So that's why I'm switching from one person to the other. So Dr. Wande, using social media, for those of us who are addicted to social media, I personally, I love Twitter. I don't listen to the news. I get all my news from Twitter, because I keep telling people that if you want to know what is happening in this country, Twitter is the first place that you will hear before channels or anybody even brings it up. So what is Mentally Aware doing about the level of the kind of information that is being put out there? Are you using your platform as well to try to suppress the amount of misinformation, disinformation, and the gory pictures and things, because those are triggers as well? So are you trying to do anything in that regard?
Okay, so for us, it's quite hard to suppress what people see. It's quite hard to control the media, hard to control what people post. What we try to encourage right now is telling people to try to be sensitive with their posting. Okay, it's not every information you get that you have to put out there. What we also encourage people to do is try and filter their media. You can filter your feed. Like for your Twitter, you can filter the kind of information you get. You can say, okay, I only want to get information. I only want to get notifications from media houses about what's going on. I'm going to try to filter what I see from other people, maybe block some people that okay, are constantly releasing information that you can't handle, or try to limit the time you spend on social media.
Or you just mute
it's hard. Mute some notifications, mute some notifications on your Instagram, mute some people, mute some notifications that, okay, I don't want to get a notification from this, I don't want to get a notification from that, and you can filter. We've partnered with Twitter so that Twitter helps us to flag problematic posts. So because of the kind of trauma that we have suffered as a nation, people can handle differently. Some people are having suicidal ideation, some people are having anxiety attacks. So Twitter has sort of helped us to flag such posts so that we can reach out to these people immediately that, oh, we just saw what you posted, we don't know what's going on with you, but would you like to speak to any of us, or we're just checking up on you, So it's we're flagging posts on Twitter, we're flagging posts also on Instagram and on our Facebook. We're partnered with them so we can monitor what people put out there. And if we see that, okay, this is really problematic, okay, we can reach out to you like, oh, how are you doing? Have you considered reducing posting this? Because we think that it might be affecting not just you, but other people who are seeing these posts, okay? It's hard to really, really, really get people to stop posting because it's also a coping mechanism for them. Like, oh, I've seen this, I think I need someone else to see this so that they don't get into trouble, or they don't, they have the information that they need. So it's quite hard. It's quite hard. But we're doing that bit. We're trying to do that bit. And then putting more resources out there for people to read and learn how to cope, or to at least know the basic things, the little things that they can do. Self-care, like Dr. Kafaya mentioned. We're promoting self-care as much as possible.
Yeah. Thank you very, very much for you and your team. Like I said, I practically lived on Twitter for the last 2 weeks, so I've seen a lot of work that has been going on in that space from your team. Another thing that I would like to bring up, not a very nice topic, but it's still something that is the issue of suicide, and suicide, the increase or the perceived increase. I don't have access to data, but I think from what I've seen online, there's been an upsurge in posts that allude to suicide, or people posting things that indicates that they are becoming suicidal. What do you think? Is there enough being done in the first place? And then secondly, what more can be done? And I would be asking both of you. Dr. Wande, you can please go first, since I'm quoting from social media. So you go first, then Dr. Kafaya can then speak from our own point of view.
Okay, so it's not like suicide, the rates of suicide is increasing. I think we're just having more reportage of it. Back in the day, people used to commit suicide a lot, but most people did not know. They'll just say, oh, someone died in that place, or someone died in that family. Now, because social media sort of has increased the coverage, so people can make problematic posts, and then someone that knows them can go, oh, and this person made this post so time, and oh, he died so time, and they can connect the dots and say, oh, this person died by suicide. Okay, and unfortunately, a lot of people have started to publicize their suicide. Like, we have cases of teenagers who committed suicide live on YouTube, or live on Twitter, or live on Facebook via their Facebook Live, and that's sort of became a problem, especially for the younger age group, because they felt, oh, this person got famous when they died by suicide. And then they start to want to do that, or start to self-harm, or start to toe that line. It's the media's duty now to change the way they report suicidal events to also help. The way we report suicide and the way the terminology is used, even though subtle, can actually change or can actually influence what people do, can actually influence people's thoughts. So media houses, social media influencers have to take responsibility for the way they report, suicidal events. Okay, not much is being done. Truly, not much is being done to combat this. In Nigeria, dying by suicide or failing to commit suicide successfully is a crime. Is a crime, yeah. And you get jail time for that, which doesn't make any sense. Yeah. Because if someone attempted to kill their self, attempted to take their own life, that's a very serious thing, and that person needs so much help. They don't need to be locked up.
No punishment.
You understand? Yeah. You don't punish someone. It's like someone going to steal because he's hungry, and then you burn him alive. It doesn't make any sense. This person was hungry. Why not do something to make sure, okay, this person is never hungry? Maybe give the person a job so that they can work, they can earn money, and then they can feed themselves. Okay? Someone is committing suicide maybe because they can't afford hospital bills, or because of a reason, or because they have a mental health issue that they do not understand. Why not get them the help they need? Okay? So as a country, it's a lot of things. Our policy as regards suicide has to change. Because anybody that is going to commit suicide is going to be like, okay, let this thing be successful so that I don't go to jail when people find out this is what I tried to do. You know, and that on its own can fuel people's suicidal ideas, can make people more bent on committing the event so that they escape punishment from their mind and punishment from society, from the government. And also the way the society, like our beliefs have to change. Our beliefs have to change. When people find out, oh, this person has suicidal ideation, or this person has attempted to kill themselves, they start to shun them. And they start to stigmatize them. Like, this person already has enough self-stigma. You don't need to add your own. But so when they know that all these things are going to happen to them, it makes matters worse, and it makes it really, really, really worse. So, like, we have a lot of work to do as regards suicide intervention, as regards our policies around suicide, our policies around mental health generally, and mental health problems.
Thank you, Dr. Wande. Dr. Kafaya, do you want to add to that?
Yeah, so maybe just a few things here and there. So suicide isn't new. That's one thing we need to know. So the earliest studies done in Nigeria was around 1952 or so. And then it had reported suicide to be 1 per 100,000 in the population. Okay. By 2012, it had moved to 6.5 per 100,000. So definitely, in a way, it's increasing, although there is more reportage. And then, of course, the population is also expanding. So I guess it also expands as the population expands. Then by 2012, which is the last reflection of the WHO studies, it had moved to 9.5. Currently, that's 2015 rather. So currently we are using the statistics of 2015, but we know that 9.5 per 100,000 population is nowhere near the current, the reflection. Right. So yes, it is on the increase. As when I was doing my residency in Louth, we used to see cases of this, but because you're bound by ethics and all of that, it's not like, of course, we won't talk about it. So we used to have a lot of, suicide and attempted suicide. And like Dr. Wande has said, yes, social media is what has brought it to everybody's household, and people are not talking about it. It's a good thing in that regard that, yes, people are more aware, but suicide has always been, and it shouldn't be as if it's a problem of our own generation. It's not true. It's been there, and it cuts across many generations, and it's a global phenomenon. This, like they always say, the global count of suicide is 1 million. It's not just here in Nigeria. If the 40 seconds they're talking about is not in Nigeria, then it's in Ghana, or it's in, it's in Paris, or it is in the US, or it's in the UK. And for one that is not successfully done, about 25 to 30 other attempts were made all over the world. So it's not a Nigerian problem, it's a reflection of the problems, all right? And I do agree with her that a lot of laws regarding mental health in Nigeria has to change. I think it's the criminal code, the Nigerian Criminal Code, subsection 327 or so, that says that someone who attempts to kill themselves should be jailed. And I agree with all her sentiments. These people need help, and they should not go to jail for it. There are other people do a lot of good work. There's been efforts from different angles. Mentally aware is they do a lot. I also want to use the opportunity to talk about another hotlines that I know. I even want my man one of it, and I know that what Google has been able to do is, if you Google maybe ways to commit suicide in Nigeria, there are some hotlines. It's called the SOPIN hotlines, the Suicide Research and Prevention Initiative hotlines in Nigeria. They pop up. So I know people call and they say, oh, I was going to, I was Googling suicide something about suicide, and then this hotlines popped up. Are you really? And then we go ahead to say, yes, we can refer you to, help all over Nigeria or wherever you're at. So efforts like that is in the right direction. We can't do it alone. I mean, we're only doing half, and even sometimes you're so overwhelmed that even those hotlines, you yourself, you don't have any more to give, because the problems is not like it isolates you. We're all in this together. I'm also nursing my own wounds. I'm also nursing my own fears of uncertainty. And then there's so much, and we need a lot of people to come on board, trained people or people who are passionate about that can get the required training to definitely add and support the efforts that is already on ground.
Yeah, and I think that in addition to all that, educating ourselves as well. We talked about that earlier. You also mentioned it, where rather than try to guilt trip the person, you want to show empathy, you want to show understanding, you want to show support. Because one of the things we know is that suicide is where, at that point, where the person feels all alone and there's nothing else to lose or to live for. So giving them something to anchor to is also key. That is one thing that I think we as individuals, that can be our own contribution to trying to stem this issue. And we also need to read as much as possible about it, get familiarized ourselves and everything. Very, very insightful conversation. In your opinions, again, so Dr. Kafaya, I'll start with you. What is the best way now to improve the mental health well-being of a people? I'm talking generally now. We've focused a lot more on individuals and what individuals can do to self-help and self-heal and all that. But as a collective, what's the best way to improve the general mental health well-being of a people?
The first thing we'll still have to go back to the issues of awareness, because it's only when people know that they can key into what you're talking about. So right from you and I and everyone around, and that's why we're talking about raising a new generation. So from the children that we're raising right now, let them know that there's an entity that is called their mental health. Let the boy child know that it is okay when he's hot to express it, but you give him ways of solving whatever is making him hot, rather than trying to hush those emotions and saying, oh, you shouldn't be a softie. It's okay to have emotions, it's okay to express emotions, for as long as you're able to deal with those emotions and rise up from those emotions. And that's where what we need to focus on right now. Being aware and then accepting our vulnerability, accepting that, see, I'm human, and being human would come with these trials. It's not like our parents didn't have their own fair share of all the struggles, but how did they deal with it? Religion is good, but many of them diverted it via religion. So it was something that was never talked about. They took it, to God, and it is good to hold on to religion, but it's also okay to have problem-solving skills, deal with issues, and not sit on it or wish it away, because many people tend to use that. For you to be mentally sound and for you to, to have your mental health to be intact and in the long run, for your well-being to be okay, so to speak, you must be equipped with problem-solving skills. You must continue to identify that, yes, issues would arise, and I must be resilient enough to come back or to deal with it. You must be able to know the things that are in your power. What are the things that I have control over? that I can say I can handle? And what are the things that are way beyond my control? A lot of things are beyond our control as human beings, but we have not come to that knowledge. Being able to sort through things. Anything that is going to, like, if there are a lot of questions we keep asking ourselves. For example, I remember during the pandemic when we were asking ourselves, oh, how long is this pandemic going to last for? What is going to happen after the pandemic? We don't have control over things like that. So learn what is within your control, and then shift your focus to things that you have control over. Like, self-care, like being able to pray, like putting effort in the little things that you need to do to secure your future, like showing up at work. Like, do you understand? But people are anxious of the future that they have not done anything in the present day to handle. Deal with the present, live in the present, put the right effort in the present, so that the future will be free. Exactly. Yeah. So yes. So I'll leave Wande to add hers as well.
Okay, thank you.
Okay, so I agree wholeheartedly with everything she has said, and something she said reminded me of the serenity prayer. I know a lot of us know that God grants me the serenity to accept the things I can, the things I cannot change, the courage to change the things I can, and the wisdom to know the difference. See, as a people, we have to know the things we can control. A lot of things we're going to experience in life, we have no control over them. We have to just learn to adapt. And funny enough, human beings are the most adaptable creatures, especially Nigerians. There's nothing we cannot adapt to. You cancel some means of transportation, we adapt. We start leaving home earlier than planned so that we can meet up with our commitments. You change fuel price, you change everything that changes, we can adapt to it. So the truth is, we need to remember that we can adapt. We need to remember that we can handle whatever is thrown at us. Living in the moment, living for the now is also very, very important. Like like Dr. Kafaya said, try to handle every day as it comes. Okay, so this is what's happening today. Okay, I can't do anything to change that. I can only control how I react. I can only control how I react to this. Okay, am I so tired today? Is this trauma too much for me to handle today? Okay, so all I'm going to do today is sleep. That's self-care. All I'm going to do today is watch TV because I can't watch the news. That is self-care. Knowing what works for you and knowing how to withdraw from all the media, how to withdraw from all the bad news, depending on what you can handle. Some people can withdraw. Some people cope by actually watching what's happening, by actually still exposing themselves to the trauma. It's not healthy, but that is what makes them cope. So for those, if that's your coping mechanism, watch it, but remember to take breaks. Remember to take breaks from everything, from social media, from your phone, from TV. Remember to take breaks. Remember to eat. Remember to brush your teeth. Little things, like Dr. Kafaya said earlier, little things that we take for granted are the things that would actually help us in this time. Being with friends and family, if you can, reaching them on social media. Nowadays, we can't see ourselves physically, but checking up on your loved ones, just calling, hey, how are you doing today? I just wanted to check on you. Having little conversations with people that matter to you would actually also help us be resilient in these times.
Yeah, so essentially, maintain as normal a routine as possible. Those little things, they help to keep you grounded, right? Thank you very much. So it's been a very, 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 very interesting conversation with the both of you. I've learned quite a lot, and I'm sure that those who are listening, those who are tuned in as well, have also done the same. Before we close, I would just like to ask if you have any other thoughts. Maybe there are things that are on your mind that none of my questions I've touched on, and you think will be beneficial to the audience. Are there any things you'd like to share? Dr. Wande, would you go first?
Okay. For me, all I like to say is, please remember that your mental health is important. A lot of us tend to neglect our mental health and just focus on the physical, but your brain is physical and it has a lot of things in it that can cause imbalances. A lot of us, the worldwide statistics says 1 in 4 people will experience a mental health challenge in their lifetime. Doesn't mean that everybody will, but most likely everybody will at some point. Like now, the whole of Nigeria is experiencing trauma. So all of us have have an increased tendency to experience a mental health challenge. Look out for yourself. Try to know your normal. Because if you don't know what is normal for you, you're not going to know when something starts to go wrong. Know your normal. Know the normal of the people around you, your friends, your family, your close relatives. Try to know their normal so that you can spot changes, so you can help. Because a lot of the time, you're going to be the first point of call before they can access professional help. Try to stay informed. Try to take care of yourself so that you can take care of other people. Try to have the right information. Try to have the right resources and listen. A lot of the time when people have mental health issues, they tend to want to talk about these problems. So you have to open up yourself to be able to listen, to be able to recognize that this person wants to talk about something. It's hard to do, but we need to become better listeners and better empaths as people. We need to become better empaths and never forget that our mental health is as important as our physical health.
Thank you, Dr. Thank you very much, Dr. Wande. Dr. Kafaya.
I'd just like to send a very strong message of we are not alone to people. I know that people tend to look at people who provide these services, like mental health advocates and facilitators and experts, as, oh, you have it put together, your life must be very fantastic. It's not true. I want people to know that, see, we're in this boat together, we're feeling this heat together. The uncertainty that is staring at you is the same one that is staring at me. The same palpitations that you experience when you have just received the news is the same one that I am experiencing. But the only difference is, because I've been able to compare, to say, okay, this is how I'm going to help myself. So I've been able to box things. So look, get these tips to help yourself to roll through this. We're all rolling through, we're all in this mess together. And I really do hope that we'll all come out and emerge, stronger. So don't think that all the everything is just in your own direction. It's not true. All right. And then another thing that I would like to say is, as people, we need to be more responsible this period. Do everything to protect yourself. Do everything to also, to protect the society and the environment they are in. Please, people should stop sharing unverified information on social media. We should try as much as possible, do what we can do to curtail, this anger that is spreading. Because at the end of the day, we're still all that we have, and we're still, the best people to try and, to put a stop to it as quickly as possible. And then finally, I'd like to talk about my platform as well. It's called empathyspace.ng. We also put out a lot of resource and basically just messages to show compassion, to encourage people that, this is not the end, and we will come out, on the other end, we will emerge victorious.
I'm very, very sorry. I was going to round up, and then I realized, I got so into the conversation. Right. I totally missed questions that had been published in the Q&A session. So I apologize to everyone. It was a very engaging conversation. So I totally did not notice the questions pop up. So I will ask one question here that says, it's from Anonymous, that says, as a mental health specialist, can you advise on how to handle anxiety or panic attacks, especially when one is by his or herself? Dr. Kafaya, please.
Please, let me say this. And I always like to say this because I want people to recognize that vulnerability. You see, we all have these times when we feel like we're out of steam and you're not breathing. What you need to do, the quickest and the easiest thing that you can do to yourself at that point, is to ground yourself and to regain control, seize control over your breathing. Okay, everybody should know that. It's the same way when you feel like you're going into an exam and then your heart suddenly starts beating, or an interview, and it feels like you're not breathing you're not breathing well anymore. Please, what you need to do to yourself is call yourself. That's what I do to myself. I always talk about my own self because I know myself. Sometimes I will just excuse myself and somebody will be like, what are you doing? I'm like, I'm practicing my breathing exercises. Yes, I do breathing exercises myself because I also have a brain too, and I also feel panic at times. So anyone that is listening to me, whatever you're experiencing or feeling, please, you're not alone. And it is not just your portion, and it's not an attack on you alone. It is just because of what we're going through as a people. What you want to do is you want to seize control over your breathing. Call yourself. So I would say, Kafaya, breathe. And what I would do is I would take in breath into my lungs. I would expand my lungs to full capacity. I'm trying to break that irregular cycle of the breathing that has, that's just going haphazardly and irregularly. So I would expand my lungs to full capacity. I would then trap that air for a few seconds again, and then gradually, with my lips slightly pursed like that, I would now exhale. That's just one cycle of the breathing exercise. And then I will do that over and over and over and over again. And I tell you, it works. It works because what it does is, number one, it will calm your racing heartbeat. It will regulate the exchange of oxygen and, how you're taking in oxygen and you're bringing out carbon dioxide. And before you know, all the systems that went into overdrive before will start to normalize. So the easiest and the fastest way to abort your panic attack is to just regain your breathing. It's not going to kill you. If that was the fear, if that's the panic, if that's the power that your panic attacks have held over you for the longest of time, I reassure you today that emotional illnesses usually do not kill you unless you take your life by suicide or any other means. Okay, it's not going to kill you. So just regain control over your breathing. That's what you need to do.
Okay, thank you, Dr. Kafaya. Dr. Wande, somebody posted here and said, I have realized that we are not a mentally aware society. People tend to dismiss mental health issues in our society. What is the best way to safeguard your mental health in our society? I know we had talked about it before, but could you just summarize in a few short sentences what we can do to safeguard our mental health?
Okay, so to safeguard your mental health, it's really easy. Practice self-care. Take care of yourself. Okay, know you're normal. Try to filter, when you know yourself, you know the things that are harmful to you, so you can filter them out. Okay, know what is normal for you. Know how much your mind can take. Okay, and when you know you're normal, it's easier for you to identify things that are not normal with you. Maybe you're an introvert, and then all of a sudden you're more outgoing, you're becoming more friendly, you're talking to more people, unlike what you would do normally. Okay, so this is not normal for me. Let me talk to a professional to see if, okay, maybe something has changed and I'm becoming this way, because there's some mental illnesses that can make you more outgoing, like you mentioned earlier, for example, bipolar affective disorder. Someone who it's characterized by a lot of behavioral changes that can be like a swinging pendulum. So you need to be able to know you're normal. Practice self-care. Do the things that will normally make you happy as much as you can. Live every day intentionally as possible. Surround yourself with people who you can talk to, people who can help you, and just have meaningful relationships with these people. And the thing is, when you have those kind of relationships, when you have people around you who can spot a change with you, it also helps you, because you can talk to them and they can help you get help, or they can provide help for you if necessary or when it becomes necessary. Okay, educate yourself as much as possible about mental health problems, so that you can also identify the same in other people around you. I think.
Thank you, Dr. Wande. Another question says, Dr. Wande and Dr. Kafaya, does either of your facilities have some pro bono services for patients based on cases sent to you? So
okay.
Yeah, so we definitely do. We definitely do, and from time to time on my own platform and Empathy Space, we would take in. I know that people on the cyberspace, so people who bring advocacy to the seem as if all services as well should be cheap, but the truth is it's not sustainable. We all know what it takes to run the cyberspace or to keep all the advocacy going. Yes, but from time to time, there are packages and there are pro bono services that we put up on the platform. Currently, for the NSAS, a lot of organizations did the same, and we had people come into the DMs and we did the best that we can. So yes, please look out for such packages. I don't know whether anyone is going on now because I don't want to sweet talk anyone, but I would say that from time to time, yes, for the NSAS protest, we had a couple, and I don't know when the next one is going to come on, but please look out for it from time to time. But then one thing that Dr. Yewande mentioned is the need that, we need to be responsible about our mental health. This is the thing that you also pay attention to. Some people don't want to prioritize it. You want to spend so much money, and I say this I'm not being unempathetic, but people don't just want to pay for anything that regards their mental health. You want all free. If it's all free, you wouldn't know the value of it. So even if it's just ₦1 that you're going to pay, maybe at a teaching hospital or somewhere, please do that so that you will be more committed to the service that you're receiving there. If it's free, you can decide not to turn up for that, for the service or for that session. Yes. But if you're paying for it, you will be more intentional about accessing that help. So use all the services that are available. Go to the break self-stigma. Go there and receive. Nobody's looking at you. Every other person there, even the doctors there, they have their own issues. I tell you, they are the least of their worries. It's not you that is coming to get help that they're looking at. Who says somebody in their own family does not have similar conditions? So Nigerians, we need to break free of this, this stigma that somebody somewhere is going to talk about you when you're going to get access help. It's not true. No one has that time.
Yeah.
Okay.
So Dr. Wande.
Yes. So for us at Mentally Aware NG, we have a couple. Most of our services are pro bono because we're an NGO. If you would require more help, we usually do like 3 sessions free. Okay, so when you come, we do 3 sessions for you free. And after that, if we think you still need more help, we refer you to see a psychiatrist at the general hospitals or at the psychiatric hospitals. Okay, so we offer a lot of pro bono services. You call our helpline, you're called back, and you speak to someone for free. Okay, currently we've opened more phone lines, so we have more services and more people able to render services. But like you said, it's not like Dr. Kafaya said, it's not sustainable having only free services. Our counselors, our psychologists will charge for, after your 3 sessions free, they will charge for their services. Okay, so try to maximize the resources available to you. Use your free sessions, but try to still pay for services. Pay for services actually makes you a bit more committed to your treatment, to your treatment plan. That's the answer.
Okay. So I have 2 more questions and then we can wrap up. So one was directed at Dr. Kafaya. It says mental health care is multidimensional, comprising of hospital care and community care. Which from your experience would you say needs more focus in Nigeria?
Both of them need more focus, and maybe one of them needs to be jacked from the floor because it's almost not existent. So community mental health care services is not obtainable. We don't have it here the way you have it in developed world. So right now we are still at the teething stage. So attention has to be paid, to the both areas. Yes, we need more facilities, we need more personnel in there, we need more trainings for even the people who are there. I also require trainings from time to time. So it's something that, we haven't come to any point where we can say we're comfortable anywhere. We need input, positive direction and a lot of efforts in both areas. And they both have there's some conditions, for example, that you will call a hotline, they will tell you immediately that you need to go to the hospital because it's a psychiatric emergency. Somebody cannot call you, for instance, and say, I'm hearing voices that is telling me to go and stab my mom. You're not going to tell that kind of person to remain on the line. You're going to say that person should go in for an inpatient care. So there are different areas and different things will determine the kind of, kind of intervention that is required. And for now in Nigeria, we still need all these things to be in place before we're talking about community care or, maybe people being treated in their homes. Let's even master the one that is more feasible right now in terms of our restrictions and our limitations, in terms of funding and personnel, then we can now start, diversifying as other things, as all these ones are how will I say it now, have been mastered.
Fully functional.
Yes, are functional.
Thank you. So, Dr. Wande, the last question is for you. What is the quality of services given at government facilities, and how can people help?
Okay, so government facilities are doing their best, which is the truth. Okay, they're understaffed, they're underfunded, the infrastructure is poor. So they are doing the best they can with what they have. The quality of service is improving. Okay, it's improving, it's a work in progress. It's not been so great in the past couple of years, like maybe 10 years ago, but it's better now. It's much better now. Wait times are more are reduced. But again, it still has to do with the government getting more personnel into the facilities. We don't have enough psychiatrists. We don't have enough psychologists in Nigeria. There's less than 200 psychiatrists in Nigeria as we speak. We don't even have the number of psychologists because a lot of people studied psychology, but they're not practicing as clinical psychologists because nobody's willing to pay for their services.
In banks or
they're working in banks or in oil companies because nobody wants to pay. The government doesn't want to hire them because the government is not ready to pay their salaries. Do you understand? So the people there, people in government hospitals are the real MVPs. They're doing God's work because they're grossly understaffed. Imagine a psychiatrist seeing 50 patients in one day, when WHO says the max number of patients you should see is 16. So you're seeing a lot of people. The quality of care the first person is going to get is going to be different from what the 50th person is going to get. So we need to be a little bit more understanding with our professionals. We need to be a bit empathetic with them also. We need to understand, not every time when you get there and this person is really tired, you can see the exhaustion and then you're shouting, oh, I've been waiting for the past 20 minutes. I've been waiting for the past 2 hours. Trust me, most of the time, these people don't even get a break. They don't get 5 minutes to go and eat. They don't even get 5 minutes to go and ease themselves in the bathroom because they just want everybody to be seen. They want to provide this service. So what we can do to help them is to be more empathetic with them. Most times when you're going to see your doctor for a consultation, you don't even ask the doctor how the doctor is doing. You just go, oh, hey, good afternoon, so this is my problem. Be a little kinder, be a little nicer to them. Oh, doctor, you're looking good today. See, you'll be shocked that your doctor has not smiled. Your psychologist has not smiled that whole day. They've just been listening to problem after problem after problem. It is their job, but you can make it a little easier for them. You can be kinder. You can be kinder. A lot of people don't know how to be kind because, well, Nigeria frustrates you to the point where you're just on edge all the time. Just come in. Oh, hi, doctor. Hi to your psychologist. Smile at them. It goes a long way to make their day. It goes a long way to improve the service that you are going to receive from them. So I think that's how you can help. The service is improving. They're doing the best they can with what they have. They are trying a lot. Like, kudos to doctors who still work in federal state establishments. Thank you.
Okay. So I thought we had the last question, but what I'm going to do, because I know that we are pressed for time, what I'm going to do, I'm not going to take any more questions. I will just take one comment. Somebody here, and it's a testimonial. Person says, I want to commend at Mentally Aware NG for the good job so far. I was fortunate to use your service last year, and I am grateful that I did. The person assigned to me was very patient and saw to it that I was in a safe place. She even put in extra sessions, and when I needed more, I was referred to a paid service. Thank you so much. I have been a mental health evangelist ever since. I do hope people allow themselves understand the need to maintain a healthy mental space. I feel this is the problem mostly in a place like Nigeria. Now, the reason why I read that, even though I said I wasn't taking any more questions, was just to demonstrate to the audience that the system works, and there are testimonials, and this is somebody who has come out to testify to the efficacy of this service. Now, I've had one or two questions pop up about people asking for recommendations and things, but what I would do is that I would ask if Dr. Kafaya and Dr. Wande, you can give us the social media handles where you can be reached, so that outside of this session, because we are pressed for time, I didn't know we have spent an hour 40 minutes. It's been such a wonderful session, and I really would like to say on behalf of everybody that you guys are the real MVPs. You guys are MVPs. Yes, and you deserve kudos. No, I'm very serious, because
thank you.
You're doing what you're doing. You're functioning in a space where there's hardly any support. In fact, the space literally does not exist. You are creating the space in which to function. So I can understand how hard it is, and the fact that you can get up and go every morning, day in, day out, is something that we appreciate and we commend. So on behalf of everybody, I would like to ask for, I think for at Mentally Aware NG, you can find them on Twitter at Mentally Aware NG. Is that the same for your Instagram?
Yeah, same for Instagram and Facebook.
Okay, so please, if you have any other questions, if you feel you require the service, do not hesitate to reach out. Dr. Kafaya, please, how can we reach you as well?
On all social media platforms at empathyspace.ng.
At empathyspace.ng on all social media, so Facebook, Twitter, and Instagram. Again, it cannot be overemphasized, it cannot be overflogged. Our mental health is very, very, very important. Know your normal. Look out for what is deviating from your normal or the normal of the person around you. Please be empathetic. Do not try to guilt trip anyone into thinking, oh, is it all about you? I also have my own problems. You know, Nigerians have a way of comparing. My own is worse than yours. Please, that is not the time for that. I know it reflects for us. That is not the time for that. You know, let's be supportive. Let's show them that they are not alone. And together we can beat this. Thank you very much, everyone. Thank you to our speakers. Thank you to our audience. I wish we could do this again and again and again and again. It was a lot of fun for me and very, very educative as well. And I'm sure people learned.
Thank you.
Thank you very much. Thank you very much.
Bye.
Bye. Thank you, Jude. Thank you, Dr. Kafaya.
Thank you.
Bye.
Bye.